Hello friends, today is World Mental Health Day, so we are going to discuss about World Mental Health Day 2023. The contents of our discussion is what is Mental Health Day, the theme of 2023, and now about depression. Coming to the first slide, World Mental Health Day, it is celebrated in 10th October. It is an awareness, it is an international day for global mental health education, awareness and advocacy against social stigma. And it is first celebrated in 1992 at the initiative of World Federation of Mental Health, which is a global mental health organization with members and contacts in more than 150 countries. So the main aim to celebrate World Mental Health Day is to create awareness, is to increase the awareness about mental disorders and to educate people regarding the mental disorders or mental illness. The theme of this year is that mental health is a universal right. Mental health it is a basic right for all people and everyone whoever and wherever they are has a right to highest attainable standard in mental health. And good mental health it is important to our overall health and well-being, and having a mental health condition should never be a reason to deprive a person for the human rights to exclude them from decisions about their own health. WHO continues to World Health organizations such as WHO and other organizations, they continue to work with its partners to ensure this mental health is valued, promoted, and protected, and that urgent action is taken to and everyone can exercise their human right and access the quality of mental health care they needed. So today we can discuss a little about depression. What is depression? Symptoms, when to see a doctor, when to get emergency help, depression causes and treatment. What is depression? As you all know that depression is a mood disorder which causes a persistent feeling of sadness and loss of interest. You may have trouble during normal day-to-day activities and sometimes you may feel as if life isn't worth living. And the symptoms include feeling of sadness, tearfulness, emptiness or hopelessness, then angry, loss of interest or pleasure in activities such as sex, hobbies or sports, then sleep disturbance, tiredness, lack of energy, reduced appetite, weight loss or increased cravings of food and weight gain, anxiety, agitation, restlessness, trouble thinking, concentrating, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts or suicide, then unexplained physical problems such as back pains, headache. In young children, depression may include sadness, irritability, worry, aches, pains, then underweight, etc. In teens, it includes irritability, feeling negative, worthless, anger, poor performance, then feeling misunderstood, extremely sensitive, self harm, loss of interest in normal activities, then avoidance of social interaction. In aged adult or in old age people, the symptoms include memory difficulties, then physical aches or pains, fatigue, loss of appetite, often wanting to stay at home, then socialize. Like a hesitation is there for of socializing, then suicidal thinking. When to see a doctor? If you feel depressed, make an appointment to see your doctor or mental health professional as soon as possible. Don't hesitate to take treatment as it can worsen the situation. When to take emergency help? If you think you may hurt yourself or attempt suicide, call your doctor or mental health professional. Reach out to a close friend or loved one. If you have a loved one who is in danger of suicide or has made a suicide attempt, make sure someone stays with that person and take the person to the nearest hospital emergency room. The causes of depression it includes brain chemistry, that is a chemical imbalance in the brain, then hormone levels, changes in the hormone levels during different periods such as menstrual cycle, postpartum, then perimenopause, menopause, etc. Then family history, early childhood trauma, brain structure, some medical conditions such as chronic pain, Parkinson's disease, then substance use, alcohol misuse, etc. Then chronic or emotional pain as it continues can cause depression. Treatment for depression include medications and that includes selective serotonin reuptake inhibitor, serotonin and noradrenaline reuptake inhibitor, tricyclic and tetracyclic antidepressant, atypical antidepressants, noradrenaline and dopamine reuptake inhibitors, then MAO inhibitors, then NMDA antagonist. Psychotherapy can be done, which is also known as talk therapy, and cognitive behavioral therapy. That is, the therapist will work with you to uncover unhealthy patterns of thought and identify how they may be harmful behavior, they may cause this harmful behavior. Then the treatment also consists of dialectic behavioral therapy. It puts a specific emphasis on validation or accepting uncomfortable thoughts, feelings, etc. Then psychodynamic therapy, which is a form of talk therapy. Then light therapy is there, electroconvulsive therapy is there, ECT is there. Then for treatment of depression, meditation, stress, anxiety, and anger are triggers of this depression. So patient can help change the way your brain responds to these emotions. Natural remedies and lifestyle tips are also there. Exercise is a very good remedy to control depression. 30 minutes of physical activity 3 to 5 days a week. It can increase your body's production of endorphins, which are the hormones that improve your mood. Then avoid alcohol and substance use. Learn to set boundaries, to set limits. Then take care of yourself. Plenty of sleep, eat a healthy diet, avoid negative people, and participate in enjoyable activities. Sometimes depression doesn't respond to medication, so a combination therapy will be needed in that case. Love yourself. Yes, living and fighting against depression is indeed difficult, but never give up on yourself. Support your loved ones. Your words can do miracles in life of people living with depression. Don't feel reluctant to do therapy. Remember, depression is a disease and not your fault.